With repeated contraction, why should a muscle undergo fatigue? In other words, what are the causes of fatigue? Now, there are many causes of fatigue. With repeated contraction, there is a slow building up of potassium ions. So there is a local increase in potassium ion concentration, leading to a decrease in excitability of the muscle. So this is one of the causes of fatigue. Also, as oxygen supply becomes limited, the muscle switches to anaerobic metabolism, leading to the accumulation of lactic acid. So this causes local acidosis, which in turn leads to alteration of the contractile muscle proteins, and this causes fatigue. Also, there is progressive depletion of ATP, which is an important cause of fatigue. We also have an entity called central command fatigue. So the synapses in the central nervous system, which are sending out motor command signals to the muscles, undergo fatigue much earlier than the muscle itself. This is referred to as central command fatigue. And this is good because this protects the muscle. Much before there is structural damage to the muscle, there is fatigue of the synapses in the central nervous system. So this makes sure that the muscle activity is terminated before there is structural damage to the muscle. You're probably aware that after death, the muscles slowly begin to stiffen. The body gets locked in the stiffness. This is why immediately after death, the person's body is straightened out, because this will not be possible once the stiffness has set in. So this stiffness that sets in after death is referred to as rigor mortis. So let us look at some details pertaining to rigor mortis. Now, rigor mortis is defined as the stiffness of muscles following death. It begins within 1 to 3 hours after death, slowly peaks in 12 to 24 hours, and then lasts for 1 to 3 days before bacterial decomposition begins. It has a specific pattern. It starts in the facial muscles and then spreads to the other parts of the body. Also, skeletal muscles stiffen first, followed by smooth muscles. So why should the muscles stiffen after death? In other words, what is the basis of rigor mortis? Now, one of the things that happens immediately after death is that all the cell membranes become very leaky. They become highly permeable. So in the muscle, we know that calcium is stored inside the sarcoplasmic reticulum. So this also becomes leaky. So calcium leaks out into the sarcoplasm and is made available to the actin and myosin. So now there is actin-myosin binding, leading to muscle contraction. But what happens to ATP after death? Now, there is no new synthesis of ATP after death, and whatever ATP was already synthesized, that is quickly used up. So we don't have any more ATP available. And we know that ATP is required for detachment of the actin-myosin cross bridge. Therefore, actin cannot detach from myosin, and that leads to a failure of muscle relaxation. So the muscle becomes fixed in a contracted state. But after 1 to 3 days, there is bacterial decomposition of the muscles, and that leads to softening and a breakdown of rigor mortis. Now, why are we talking so much about rigor mortis? What is its significance? Now, in cases of unnatural deaths, this is of medico-legal importance because this can be used to determine the time of death. What are the changes that accompany muscle contraction? There are electrical events, chemical events, mechanical events, and thermal events. The main electrical event is the propagation of the muscle action potential along the sarcolemma and the T-tubules. The chemical changes include the association and dissociation of ATP, myosin, and actin, that is the cross-bridge activity, and also the release of calcium ions. The mechanical changes refer to the attachment of actin and myosin, the power stroke that follows, and the detachment. And then there are thermal changes, which we shall discuss next. During muscle contraction, heat is generated in the muscle, and this can actually be measured with the help of an instrument called thermopile. So let's study the thermal changes that accompany muscle contraction. Now, even at rest, a small quantity of heat is generated by the muscle, and this is about 300 calories per minute in an average adult. Now, once the muscle starts to contract, there is a rapid generation of heat, and that is called activation heat. Then the muscle shortens and the heat generated is in a slower manner, and this is called the shortening heat. Greater the muscle shortening, greater is this heat. Then the muscle relaxes and the heat generated during this period is called relaxation heat. And finally, as the muscle recovers in the presence of oxygen, there is more heat generated, and this is called recovery heat. With that, we come to the end of this session. Thank you.